Greetings. I am Dr. Sanjay Garg, consultant urologist and andrologist practicing in Ghaziabad, currently at Manipal Hospital, Ghaziabad, and director of Helios Stone and Urology Center, Ghaziabad. So today we shall be discussing about cancer prostate. As we all know that prostate is a gland, accessory sexual gland, which is only present in males. It is situated just below the bladder neck and it normally compresses the urethra. So whatever the symptoms of its disease comes, that is because of the enlargement and compression of the urethra. And it enlarges after the age of 40 years. So the symptoms come after the age of 40 years. But what is cancer? As we all know, that cancer is uncontrolled growth of the cells. It can occur in any part of the body because cells are continuously multiplying. Normally, the growth is not very well controlled, so it is not uninhibited. But when it is uninhibited, then it grows like anything and it can grow beyond its boundary. So when cancer occurs in prostate gland, then it causes symptoms because of its compression over the urethra, and its metastasis means when it spreads to other organ. So now we should know that who all can get cancer of the prostate or carcinoma of the prostate. There is many queries that whether a person he himself says that will I suffer from cancer or not. Though there is no particular predisposition to this disease, but there are certain ethnicities. That is African American man older with older age group. Certain races are also there. So in those races, especially African American men, there are high chances of developing cancers. Our Asian population, they are having less risk for developing cancer. After the age of, say, suppose 50 or 60, there are chances that increases in age. Then when we take high fatty diet or obesity, these all factors can affect the cancer. When it develops in prostate, so first of all, the symptoms will come as normal enlargement of prostate. Prostate, when it normally enlarges, it can cause two types of symptoms. One is obstructed symptoms, other are irritated symptoms. What do we mean by obstructed symptoms? Obstructive symptoms are that person has obstruction in passage of urine. He will complain that he is not able to pass urine completely. There is decrease in flow, interrupted flow. Sometimes he feels that after voiding, there is persistent sensation or that urine is present in the bladder. These are obstructed symptoms. Now coming to the irritative symptoms mean which are because of the overactivity or irritability of the bladder. That is increased frequency, especially at bedtime or night time. During he has to get up many times from his sleep. There is urgency whenever he suffers that he has a feeling that he has to pass urine. He has great urge. He has to rush to the urinal, and sometimes he can also leak. So these are the irritative symptoms. These are normally also seen in normal enlargement of prostate, that is benign enlargement of prostate. Similarly, it can also be a first symptom when a prostate enlarges because of the cancer. But what other symptoms can be there because of cancer? They are normally seen when the prostate this cancer spreads, and like there is bleeding in the urethra, bleeding per urethra. When he passes urine, then there is blood in it. When it metastases to the bones, he can have backache or bony pains. Then there might be certain other things associated with decreased health, like he might feel that he is feeling very weak. There is weight loss. These are normally the symptoms. And how do we come to know that a person is suffering from cancer or not? When a patient comes with these symptoms, that is especially the urinary symptoms, we have to evaluate. Very important is the clinical history. As I mentioned earlier, that during the history, we say whether a person is having family history or not. Because if a person is having some family history of prostate cancer, maybe his father, his brother, or great grandfathers, if they have ever suffered from prostate cancer, there is high chances that this person may also get cancer. This increases by nearly 50%. So we have to evaluate the history, the symptoms, then do a clinical examination. The most important clinical examination is digital rectal examination. That is per rectal examination. We feel when a prostate is enlarged by in cancer, then it is irregular growth. A doctor can very well assess that this enlargement can most probably because of the cancer, or it's just a normal enlargement of prostate. So after examination, A urologist prescribes certain tests, especially to see the uroflowmetry, that is for the urine flow rate, ultrasound to assess the size of the prostate, the kidneys, the residual volume. Then there comes the specific test. What are the specific tests? One is blood test, which is serum PSA levels. Serum PSA is prostate specific antigen. This antigen is only secreted or excreted by prostate gland, prostate cells. So if the prostate cells are having uncontrolled growth, then the level of the serum PSA rises. This can also rise in certain other situations like simple benign enlargement when it is too much enlarged, or prostate is suffering from other disease like inflammatory disorder, infections. But in those cases, the rise is not that much. To differentiate it, either it is with clinically, or so we can go for certain other tests like PSA density, PSA velocity. So this is the PSA test. What other test? Now, when we suspect that patient is having this prostate cancer, then we can go for some certain radiological investigations. What are those? MRI. MRI is magnetic resonance imaging. MRI of the prostate area or prostate gland. A specific MRI is there, which is as multi-parametric MRI. And after MRI, we also go for the prostatic biopsy to confirm, that is the tissue diagnosis, to confirm whether that prostate is harboring cancer or not. If all these things are done and we are pretty sure that prostate, there is cancer in the prostate. So now comes, what is the stage of the cancer? Stage means how far the cancer has spread. If cancer is only limited to the prostate, we also come to know by MRI, or other tests are there like PET CT scan. A specific PET CT scan is there, PSMA PET CT scan. In this, if it is spread to other parts, then there is uptake of this PSMA at other areas of the body. So we have to plan our treatment according to this, according to the stage, according to the histological grading of the prostate. Histological grading we come to know from the biopsy report, and staging from either MRI or PSMA PET CT scan. So finally, if prostate is limited to the prostate gland itself, then we can very well remove that prostate if it is of low grade and chances of survival, or the we can say that patient is not having other disease. If it is more than 10 years, then we can go for surgery which is called as radical prostatectomy, in which we remove the entire prostate gland plus adjoining few glands like seminal vesicle or the locoregional lymph nodes. Then this is called as radical prostatectomy. Nowadays we are doing it with either robot assisted or laparoscopy, or maybe sometimes open prostatectomy also. So this is for only when the prostate cancer is limited to the prostate gland. But what if it has spread to certain areas like adjoining region? Then we have certain other therapies which are either hormonal therapy, radiotherapy, or chemotherapy. So to differentiate or to decide which therapy is suitable for a particular patient, we have to take a proper evaluation, proper history, proper assessment by different investigations, and finally we can offer the treatment plan for the patient. So if the patient comes to us early stage, then definitely there is very good prognosis of his survival, like 10 years survival is seen nearly more than 90% if the cancer is limited only to prostate and if he takes a proper treatment. But this survival definitely decreases if the cancer is spread to other areas or patient has not taken a proper treatment. So this was all about the treatment part, the cancer part, and very important thing is lifestyle modification, dietary habits that we have to improve so that the patient either can prevent himself from getting this cancer, or maybe if patient is at all suffering from it, so that he can have a healthy lifestyle and have a healthy life along with taking the treatment for this prostate cancer. So that's all for today regarding prostate cancer. I wish all our viewers a very happy and healthy life. Thank you.